So we are here today to talk about our pain management tools and just kind of how we approach pain management as a whole as athletic trainers. Both of us work in the secondary setting. So, I feel like this could be really beneficial, especially because we both work with the same population. Um, and we can kind of bounce ideas back and forth off of each other. So the first thing that I'm going to do is I'm going to show you um, what I did with my pain management plan. I know that the first thing that we're supposed to talk about is the ask. Um, so what I did is I did some PROs. I did some pain assessment PROs. The first one that I looked at was the Oswestry Low Back Pain Disability Index. I don't know if you've ever used this one before, but it is
Mm-mm.
fantastic. It just talks about the different disabilities that a patient might have with pain intensity, personal care, lifting, walking, sitting, social life, standing, traveling, sleeping, and then sex life if it's applicable. And it rates everything, and then you look at the score. So this patient that I've been working with actually filled this whole thing out for me, and it was awesome. It only takes about 2.5, 3, maybe 3 minutes. It's
Nice.
fairly short, but it gives you a decent amount of information. So this patient um, would be considered as a moderate disability. They come out to 33%, which the interpretation of that score is that the patient would experience more pain and difficulty with sitting, lifting, standing. Travel and social life are more difficult because of the pain. And then personal care, sexual activity, sleeping are not grossly affected, and the patient can usually be managed by conservative means. So for me, this
Like it.
points at, a lot of muscular pain, 9 times out of 10, but the pain can be managed without drugs. Having to go to a doctor and getting some type of an opioid or muscle relaxant or anything like that. It's something we can conservatively treat. Um, I previously used a VAS NPRS tool on this patient, but I know that they didn't want us to use that for this assignment. So I didn't use it for this patient specifically on this day, just so that we could kind of have a more realistic look at what the patient was feeling and how they were going. I also wanted to focus on this patient's mental health, just because this is something that runs in this patient's family. And
Mm-hmm.
I felt like it was extremely important to address the mental health of this patient as it pertains to their back pain, because, again, family history of depression and anxiety and things like that. So I felt like it was super important. So I used the PHQ-9. The PHQ-9 is kind of a shorter version of the DAS-21.
Right.
So again, very short, super easy, especially for those kids that are in the secondary setting that don't want to sit in your office for more than 15 minutes at a time.
Mm-hmm.
So, he sat down, filled that one out super quick for me. He did get a score of 9, which would be considered as mild depression. This is something that me and him have actually addressed before. We've talked about it. And he is actually currently medicated for it. And so, I found it very interesting that the PHQ-9 actually, revealed that, yeah, he does have depression. So we kind of talked about that one a little bit, and how his pain actually affects his ability to do anything outside of work or outside of school, and how that might affect his moods, how that affects his depression and things like that. So that was really able to give us some good information. And then the last one that I looked at was the opioid risk assessment. I've never actually used this one before, but he does have a history of familial history of alcoholism. So I thought it was kind of pertinent, especially considering his mental health status and his pain status. So we looked at that one, which he is, of course, at moderate risk, which I feel like a lot of people looking at that one would be moderate risk anyways,
Right.
based off like family history and male or female and stuff like that. So, after we looked at, of course, the ask, then we went through and we talked about functional goals, and we actually set goals. So he actually has a printout of this entire sheet that I'm showing you.
Nice.
So he wants to look at consistent sleep, 8 hours every night with one or less disturbance. Right now he's experiencing 3 to 4 disturbances of sleep per night. And so we want to reduce that as much as possible. He wants to be able to throw discus and shot and track with minimal pain. He says, senior year I can deal with pain, but I would like to be able to just be as minimal as possible. Same thing with 4x4. He would like to reduce his pain level down to a 2. Currently it ranges between a 6 and an 8, give or take, on the day and the activities that he's performed. And then we went through just some pain management strategies, and we went through and I talked about, manual therapy. We're going to look at alignment of hips, core strengthening, specialty consultation. He actually does have a disc disease appointment because that runs in his family for 4/9. So that's next week. Mental health, I wasn't 100% sure how to approach this, to be honest with you. That's not something that I'm super comfortable with. And we actually don't have a, what do you call it? Counselor.
You don't have any counselors?
No, we don't. We have academic counselors, but we don't have any like mental health counselors at all. It's something that I've been frequently fighting for, because we had one 2 years ago and she just up and left and they just haven't hired a new one, which is interesting considering the amount of suicides we've had in our school in the last like 6 years.
Yeah. Okay, we can come back to that. I'll let you finish and then we can talk about
that. Medication, I didn't want anything too strong. For pain, just ibuprofen is directed, or Tylenol. And then, of course, he's on his own personal medications. We're going to look at using TENS and cupping and massage therapy as therapeutic modalities just because I'm kind of limited with what I have here. But those are a few of the machines that I do have. And then, just again, sleep, self-care. I've provided stretches along with a home exercise plan for him to perform at home. And then integrative approaches. His mom actually asked about CBD oil
Nice.
because she uses it. And there is a CBD shop here in Lafayette.
Nice.
It's something that I'm actually currently talking to my supervisor about just because I don't know the rules and laws behind it. Like it's never something that's actually came up before.
It's not legal there.
Is
medicinal legal there?
Medicinal is, I don't think any form of THC is legal here, but CBD.
Oh, fair enough. Right, the CBD oil, that's totally different. You're right.
Yeah, so, same plant, just different, part of it.
Right.
It's not something I've ever actually ran into, so kind of interesting and new to me, so I'm trying to find out as much as I can about it. Because all of this popped up earlier this week, so this assignment kind of fell at the right time. Biofeedback, we're going to be doing adjustments and hip mobilizations and using biofeedback for pain, especially considering this is the stuff we're learning about in manual therapy.
Awesome.
What'd
you say?
Oh, sorry, did I freeze?
No, what did you say though?
Because this is what we've been doing, like mobilizations and stuff like that.
Oh, because we're in manual therapy.
Yeah.
Okay,
yeah,
I heard something else.
Oh, sorry. My internet here at the school is terrible.
You're good.
So, mindfulness, we're going to apply kinesio tape to allow for posture adherence because he's got terrible, terrible posture, as 90% of kids do these days. And then I don't know if you've ever heard of the wrapping and relaxation method before bed. It's basically, you've probably done the method where like you tense up all your muscles and then you start at your toes and you slowly release everything. It's pretty much the same exact thing except for you cross your arms and you kind of pull, and it allows for a little bit more of a focus to be placed on the muscles. Something that I was taught by a therapist one time, and I felt like it really worked. It works for me, like to help me sleep, helps relieve stress, stuff like that. So we talked about doing that before bed. And then we're going to reassess on 410 using, all of the same PROs and stuff after his doctor's appointment. So, yeah.
So he has a doctor's appointment.
Yep. Yeah, he has a doctor's appointment next week to go have his low back pain looked at because he has a familial history of disc degeneration and osteoarthritis in the spine. So. Yeah.
Good. Good.
But
Okay.
you had a comment from earlier.
Just that I'm kind of surprised that the counselor, like our school counselors, I rely on heavily for stuff like that, like mental health things. I rely on them quite a bit. So have you, I'm sure you've had a conversation with them, or do you want like a specialist or something for mental health?
No, the thing is like if I were to I've sent somebody up to the counselors before,
Mm-hmm.
and they basically came back down to me and said they basically told me that I need to go see a licensed therapist, and
Oh,
there's not anything they can do for me
oh,
because they're
which,
just academic counselors. And so, like,
okay.
for the first few months that I was here, I was like, well, maybe I can help some of these kids, but it became such a burden on me that
Right.
I
Yeah.
finally found a network
Yeah.
through,
You got to get help.
yeah, so I found a network through Franciscan and started referring kids because,
Good.
there was a lot that was going on here that I was like, holy crap, guys, like, no wonder, like, our depression rate's so high.
Hmm.
So it's kind of a bummer, but we're getting the help that we need
That's
from
good.
external sources.
Yeah, for sure.
So,
Right.
but yeah, any
Good.
questions, comments?
Okay. Um, no, other than I like that disability tool. I think I'm gonna give that one a try. I like that one. Um, um, what does this patient do? Like, what is their primary sport? Just track right now.
Just track right now, but this is something that we've been battling. Well, he's been battling it for the last couple of years, since
Yeah,
before I got here.
gotcha.
And then this is something that I've been helping him treat, just
Mm-hmm.
conservatively, and we've been managing his pain. But in the since basketball season, it got worse, and
Mm-hmm.
so he's taken the last week and a half, almost 2 weeks off to see if that would help. And since it hasn't, his mom finally allowed me to push her in the right direction and get him into a specialist that's going to look at him.
Okay, good.
So, because it's been consistent for the past couple of years, and I've actually got 3 kids that have spondies right now, that occurred before I got here, and we discovered it in the fall when I started.
Yikes.
Yep. So we've got a lot of back issues going on here, and a lot of them I'm slowly discovering more and more issues, that like I'm trying to fix through a million and one different means. But it's a process coming in. We've never had an athletic trainer out here before, so
Mm,
I think that was another
dang.
problem.
I mean, that's huge for them that they
Mhm.
have you now.
Yeah.
Okay.
So
Um, Scroll down one more time to your to like the plan. I feel like there was something that I like that you are integrating manual therapy and you're checking the hips too. That's a great place to start. Um, does so this patient has a history of mental health issues and stuff like that?
yeah.
Are they medicated for that?
Yes.
Okay.
Yep.
So just continuing to take that medication.
Yep.
Okay.
Yep.
On
As
top of
directed
that
by the
ibuprofen.
physician.
Okay. And then TENS and cupping. Nice. I think that looks really good. Yeah, definitely look into the CBD and see what that protocol could look like.
Mhm.
Because, I mean, there's, as we've seen in the articles that Zach, not so. Yeah, you just have to find the right verbiage to make everybody buy in, if you will.
Yep.
Because if the second you say CBD, they're going to be like, oh, no, not at all. Like, so I don't know.
Yeah, it's gonna be a tricky one.
Mm-hmm.
So, uh,
Good. And then the 10th is your follow up. That'll
yep.
be good.
Yep. 10th is
Okay.
the follow up.
Awesome. Okay. I
Are
will.
you able to screen share from your side?
I am.
Perfect.
So here's my plan over here. It looks kind of funky because I did my plan over here instead of all over here. So let me get you out of the way. So I have a baseball patient, and the pain assessments that I did was the brief pain inventory tool, and I think I have a picture of it over here somewhere. Nope. Yep, this is it. So brief pain inventory tool, so they are basically just rating their pain in how high it was at its worst, the least, average, how it is right now, and then it goes into saying, like, when you're doing certain things, how is your pain from, he has some pretty major patellar tendonitis because he's been a catcher for like 10 years now. So his knees just hurt all the time. And he hasn't really done a ton in the past to combat all the pain. So now it's like crunch time almost because they're full swing into season. No pun intended, since it's baseball. So his mood was one of the big ones that he saw his pain really affecting his mood. And everything else seemed to be pretty good except for his like enjoyment of life. That ranged depending on the day. And bye. Sorry, I'm at David's work right now, so other people are leaving. So yeah, I like this one because it's quick, and the way that they rate it, I think gives them more options than just like 1 to 5 or like looking at the smiley faces and things like that. So I like this one. There was another reason why I liked it. I like this first question because it focuses on, yes, I have this patellar tendon pain, but do you have anything other than you into something else? Oh, well, you have a hangnail. Okay, that's not necessarily what we're addressing, but this pain from your patellar tendon, this is the pain that you're talking about, and this is the pain we're addressing. So I like that question. The other one I used was the PHQ-9, and sorry that it's lopsided. I don't know why. The only thing that worried me was this 3 over here for trouble falling asleep or staying asleep, and this patient has a history of depression, so and also takes medication for that. So I wanted to kind of talk to them further about what this is. And there's a lot of things going on in his world right now that is causing him to be more stressed than normal, and it's not allowing him to sleep. So he didn't think that his history of depression or mental health was causing his lack of sleep. Mostly school and being a senior and lots of
life
stressors. Yeah, lots of senior life stuff happening right now. So with that one, that kind of set this number a little, kind of shot it up. So an 11 is in the range of moderately severe. And while I do think that number is worrisome, being able to address this with him and realize that it's not necessarily his depression that's causing this number to spike, it's more of the outside factors.
Yep.
But I think overall, and poor eating also attributed to senior stuff, and then trouble concentrating on things, mostly in class, because he's just so distracted with all the other things that he needs to get checked off his to-do list before he really wants to spend time on his classwork or pay attention to a lecture and things like that.
Yeah.
So the risk assessment, I wanted to pull that up too, just so you had an idea of what I was using. This one. So I just had him fill out the parts that were relevant to him right now. So like the physical activity, nutrition, general health. What else? Let me zoom out a little bit. I feel like safety is a good one, but we didn't spend too much time on that. Mental wellness, we focused on that one, but we skipped over kind of this last page because one, it's 50 questions, so it's kind of lengthy. But I really like the information that I got from him, and seeing like when he says, I eat fast food less than 3 times, and he put a 5 on it, which means that he eats more than that. That's not true. He eats more fast food than he should in a week. So some of the information that I got from things about like I don't protect my skin and I don't go to the dentist that often. I was like, other side conversations that we had. But so that was the risk assessment that I used for him. Again, I put that it is lengthy, but I only had him do portions that I felt were relevant to him. The goals that he is shooting for, obviously baseball, because they're in full swing right now. So he wants to be able to contribute to the team and be really successful. And then he's also training for a half marathon. He's going to Hawaii with his family this summer, and he wants to run in this half marathon for whatever reason, but he wants to do it. So I'm going to support him in that. And then he recently started a kickboxing class, and he felt like that helped decrease some of his anxiety and his depression symptoms. He was able to combat that in his kickboxing class, so get rid of a little bit of his frustration in that. So we want to decrease his pain. Obviously he doesn't want any pain, but realistically he said between a 1 and a 2 would be the most ideal. So the things that we are going to do, I put over here. Sorry for all of the
No, you're
scrolling
good.
back and forth.
Oh, you're good.
So I found this chronic pain care plan that I really liked, and he also has a copy of this, just to be super specific, and he could see everything kind of laid out for him. So these were the things that he wants to get back to. This was kind of this is our reassessment date, but we'll probably change that date later on.
Mm-hmm.
So his goals, how we want to improve his sleep, because he felt like these were the biggest ones that he wanted to tackle, and then modifying his physical activity. He is in a PE class, and he's also in baseball, so he's doing quite a bit, but we want to at least modify it so he can still do those things and not feel like he's missing out on everything.
Yeah.
And then he does 0 stretching, so we've decided to implement just some really light, simple stretches, mostly targeting like hamstrings and quads. And then the stress was a big one, so I really liked this plan because it kind of hit all of the things that he wanted to focus on. The sleep was a big one because he felt like he was just staying up all the time and he wasn't being productive. So it was like, all right, no phone after 9, and then between 9:45 and 10, like hopefully you can be asleep by then. So no medications right now. If he needs help sleeping, then we'll add something in there. The major stressors are listed there, and then a couple things that we're going to do to combat that. So the counselor, again, I utilize the counselors quite a bit for mental health, and they're really great. They're all on board for all of those things. So he's going to send, I sent an email to his counselor, and then he's going to send a pass. We have also talked about, he has a yoga app, and he's been really interested in actually doing it. And so we decided that the best time to use it would be before bed. So the 9 o'clock cutoff was kind of lenient so that he could finish his like quick yoga / stretching session, and then he could put his phone away and hopefully be ready for bed. And then I gave him a couple breathing techniques to help wake up in the morning, just to kind of be mindful and do like some thoughts of gratitude to kind of get him started. And then a couple things that we'll do in the training room, athletic training facility. Wow. We have very bare minimum, like ice and heat, and that's about it. So we're going to focus on icing and ice cup because he really likes that. So a lot of this I filled out while he was ice cupping so that he didn't have to do all of it. And then his dad is he's like a PA, I think. And so he went to a cupping class. So his dad is going to do some cupping on his quads, which since I don't have that at work and my boss won't let me do it, which is another story, he's going to do that at home with his dad. So we're just going to keep following up on that one.
Cool.
So yeah. What you got?
Actually, I really like that layout that you have for that one. I think that's like, it just lays everything out really nicely for the patient. I will say that the one risk assessment is super long. And that's like, I'm glad that you just kind of picked things that were relevant to him, because there's no way I could get any of the patients that I work with.
And when I found it, I was like, bear with me. Like, I know it's long, but it's just like don't think about it too hard. Like, whatever number pops in your head first, like circle it and go to the next one. Mm-hmm. So.
Nice.
How do I?
What kind of, we're going to do that. We're going to do that. Yeah. I mean, it really lays everything out for you. Yoga, breathing techniques. So he's been catching, you said, for 10 years?
Yeah, like since he started Little League, like that was the position that he was thrown into, and he's really good at it. But yeah, he's hurting pretty good.
That's insane. So, it's a long time.
Mm-hmm. But he's like, no college ball. Like, I'm going all out this season, and he wants to do well this season, which I get. So he's just kind of been really passive about it, and now he's like, I got to do something about it now.
Yep, I've got a couple of those.
Yeah.
So I like it. I really like that plan. I think it's really well thought out, and I love that you get to utilize your therapist, counselors, as much as you do, because that's a resource that I'm sorely lacking, and I'm very jealous.
We also have a program called Sources of Strength, which is like it's they call it a suicide prevention program, but it's more of just like an encouragement program, because we just do, like, people know who we are in the building, and they know who the kids are that are also part of it, and they know that they can talk to them. And so even something like that, if it's not a counselor, like, you at least have a trained somebody that's there that they can talk to.
Yeah.
Which is easier said than done, but.
Well, and there's multiple different forms of pain. I mean, there's physical pain, emotional pain. So,
right.
Being able to focus on the person as a whole is extremely important, I feel like. So, I'm glad that we do at least have some resources that pertain to that to make life a little bit easier. So.
Right.
Any questions, comments, concerns?